So coming to the topic of the day, it really took many people by surprise that such a remarkable remarkable progress was achieved by Dr. Gururaja sir in a case of vitiligo. And can you please take us through this case, please?
So it's a very, as you see very clearly in the picture, she is aged about 10 years, and she came to me with discoloration and this pigmentation, depigmentation issues. And it was the lesion was very active. Since last 4 months, she has been under treatment, and I'm using straight away in this Arogyavardhini Vati and Swayambhuva as well as Bringaraja Ganavati. And externally, I'm using a pigmento cream for her. And of course, sometimes even Verdura Melapro also I used it. And she is responding to a treatment. And this is the stage after 4 months of continuous treatment. You can see there is almost 50% on the lateral aspect is cleared. So still in the medial aspect, 50% is remaining. So that is one of the important remarkable thing which is achieved with Ayurvedic medications. And of course, I ask them to maintain strict patya words simply which I usually do it for all skin conditions. Same thing is applied here, that no non-veg, no oily stuff, no masalas or spicy items, and no bakery products. So such type of restrictions I usually give to even for these conditions. And of course, as I'll ask avoid the mustard oil, but of course in southern India and these areas there's no use of mustard oil, so it will be no problem. If it is in case of a North Indian, then there is a chance of using mustard oil, so we need to take care of that, consider that part of it also.
Yeah, before we get into the medicines and all, in case of vitiligo, how would you decipher the case in terms of like Ayurveda, dosha, dhatu, etc., please?
See, very clearly when the patient comes to me, I'll just check it out whether what is their age and what is their food habits. Then typically the lesion color. Lesion color is, so if it is a coppery red, then it is involvement of pitta, and this one is that. But if it is a purely whitish, then there is an involvement of kapha. But typically all these Shvitra cases, it is the deficiency or kshayavastha of Brajaka pitta. So we need to improve the Pachaka Pitta by giving improvement of the Pachaka Pitta, because Pachaka Pitta, if it is improved, it improves all the other subtypes of Pittas. So that's the reason we improve Pachaka Pitta, just like how Avalambaka Kapha will improve all the Kaphas. Similarly, this type of condition. And in this, of course, the lesion was active because the patient, according to patient history, it is that there is a variation in the size and shape and design of the lesion, the contour of the lesion. So based on that, then I thought it is an active disease. So if we can try with Shamana Aushadhi, it could be better, because these patients cannot be just straight away taken to the Shodhana procedure because they may not be suitable for that. And we can't assure by simple doing Shodhana in the beginning. We cannot assure something good result immediately, because when people spend money on that Shodhana therapy, their anticipation is something which is just like an operation. Patient is submitted for operation, and that soon after the operation, the things will be settled down. So it will not take place in that time, and they need to be counseled for this. So better for these patients, it is good to give them a continuous Shamana Aushadhi by maintaining strict diet or patya, and definitely will take some time, bargain some time from them, because it is a disease of which runs in many months and of course sometimes years. So we need to go for it, because sometimes there are stubborn nature of diseases will be there. They won't respond in the beginning, but later they start responding to that. And in the meanwhile, if it is required, I'll slowly alter the combinations of material, medicines which are given. Even for this, I got Bakuchi containing capsules and tablets are also there. And even some oil is also there for this purpose, like in the brand name of Tolenom. So which I can usually, depending upon the condition, I pick it up.
Okay. And have you ever considered, in many cases of Shvitra that you have treated, have you ever considered Virechana before or after, say, starting Shamana Aushadhis?
See, technically the book says that should be done, But many a times the patient will not be ready for these things because we are also having some sort of doubt in case of whether to consider these children for the Shodhana therapies, because if there is some complications, they will not be ready to accept it, and because it will be totally new to them. So it is better they will be familiar with something that they went to doctor and doctor given some medicine and we are consuming the medicine. That they are very much familiar, so that they pick up that type of line of treatment. While explaining, even though we have told them that there is a chance of doing Virachana and these are things, but they prefer let us start with the Shamana doctor. We'll see some months. Then, if it is required, then we'll go. Like that, they'll go. So when they start with the Shamana Aushadhi, when slowly Shamana Aushadhi itself starts responding, then they don't want to, and even we don't want to consider them for the Shodhana therapies.
Is there age related with prognosis of vitiligo? I mean, if older the patient, difficult the disease, is it like that or?
Definitely, the age of the patient, if it is comparatively higher, then definitely because the all tissues will not respond to treatment as age advances. So similarly, even the melanocytes. So that that is a part of it. We need to accept that. It will be but very young and middle-aged people that they usually when we go for a rigorous Shamanaushadhi, definitely the results are seen.
Yeah, you mentioned about Pachakapitta and stimulating Pachakapitta in order to target Bhrajakapita, which is there at the level of skin. And going through your medicines of choice, in this case, Arogyavardhini, OT and Swayambhav Gugulu and whatnot. So do you target liver or like in your mind, do you intend to stimulate liver as well, or you are considering liver in this disease?
Definitely, liver has been considered as a yakrit in Ayurveda, and yakrit is considered as typically Raktava Sroto Mula. When Raktava Sroto Mula, our target is to improve the blood and purify the blood and stimulate the pitta. So all are targeted from the source of liver. So definitely, whatever the drug we are using, like Arogyavardhini or even the Bringaraja Ganavati, definitely stimulate the pitta, particularly Pachak pitta, and to stimulate the liver to a large extent. And definitely, once the root cause or the root of the system is being treated properly or stimulated properly, then automatically it sends positive signals to other pittas in the body, and they also start behaving in a supporting line or in a sympathetic manner. So they'll also respond in a right direction, and definitely they start getting stimulated. Bringaraja is one of the drug which is very typically works as a rasayana, and it is a very good liver tonic as a liver stimulant, as well as this is one of the important Kesha and Twacha rasayana we say. So it is very good to the skin. So based on that concepts, I selected Bringaraja, and it is giving results.
That's a wonderful thing that, I mean, because the skin pigmentation needs to be regenerated. Overall, the skin has to be rejuvenated. So Rasayana makes very much sense there. And apart from these oral medicines, based on patient, do you change the combination or these are fixed almost?
It is not fixed. There are changes because see sometimes I use Arogyavardhini, along with that I use the Vitcare capsule and I use the Dermafex tablet, and sometimes I use Madhusnuhi Rasayana and Kadira Arista and even my Charmamrita powder combination. So like that there are many such combinations that is available. I can select and opt all those things as per the requirement.
On which cases, say you would use, say, Madhusnuhi Rasayana or other medicines that you just mentioned?
See very clearly when skin has to be given some finishing touches like that in any skin diseases. Once there is a Shodhana followed by Shamana, to a large extent the disease is suppressed or it is in a stage of responding. Then if Madhusnuhi Rasayana is added, then usually the things will roll fast. So it is not like that in only one. It is in many skin conditions, Madhusnuhi Rasayana can be used.